infections like urinary tract infections, toilet infections, and sexually transmitted infections are gaining importance at present due to the rapid spread, high cost of treatment, and the increased risk of transmission. Many patients of genital infections and STDs are seeking help from alternative systems of treatments, such as herbal concoctions of different names and origin, instead of undergoing proper diagnosis before treatment by the medical practitioner. Some of these treatments involve mixing ginger, onion, cloves, and garlic together to drink or use for genital steaming. But why do people prefer to go for herbal concoctions to treat toilet infections or sexually transmitted disease?
Actually, there is no way you can just by looking at a herb and decide that this herb works or not. Mostly herbs are known to work when you subject them to a trial. So like most people, they used to try it on other people over time. They come to understand that when you take a particular herb, there is particular changes that brings to human body. But when you go back into the clinical terms, any herbs must be taken to the laboratory, must be subjected to the standard scientific principles to determine safety, efficacy. Why determine safety is to protect the people who are going to take that herbs from unwanted complications, and also the efficacy determine the dosage at what dose would that medication works. But by mere looking on a herb just like that, you cannot determine whether this herb will work or it will not work, because herbs are not medicine. Herbs, literally, you can call them, they are drug. And whatever gets into the human system, it changes the physiology and alters the function of the entire human body. Some herbs can increase heartbeat. Some herbs can even decrease blood glucose, which can lead to even hypoglycemia and coma and death. So there are a lot of things that these herbs cause. So the thing is that before any herb is taken, that herb must be tried, must be evaluated for safety and for efficacy, and also to determine at what particular dose that herb will not cause damage to the human body, and at the same time will work and bring about a solution. Actually, there is a report by the World Health Organization that says that almost 80% of Africans depend on traditional medicine for their own health medication. And the reason could be simple, because when you look at Africa, the healthcare facilities do not reach nook and crannies of most villages. So most people, when they find themselves in those villages, they have to rely on the traditional medicinal practitioners for their own medication. And secondly, is accessibility. Sometimes before they go to cities, and even because of the economic hardship, the transport fare they could use to go to the hospital, they would rather use it to buy traditional medication very close to them. So it's very accessible. At the same time, they tend to be cheaper than the conventional medication. And another factor is that, even the conventional medication, they got their roots from the herbal medication. When you look into a herbal medicine, mostly they are a cocktail of many herbs put into one form. So when you look into that cocktail, there are a lot of phytoactive substances, for example, like tannins, anthraquinones, phenols, polyamines, and so many. So you tend to find out that when you have a cocktail of herbs, inside them you can have a particular phytoactive compound that specifically targets maybe the bacteria or the microorganism that causes the infection. At the same time, you can have another phytoactive substances that goes and boost the immune system. And at the same time, maybe that herb contains other phytoactive metabolites such as trace elements, some even vitamins that will help and support the body in discharging its own duties. At the same time, our unconventional medication, it differs from herbs because most of the times we have a single-lead compound. Like out of those cocktail, we identify one, we studied it, extract it, and even synthesize it, make it into a normal structure and form a particular drug. So in herbs, you have cocktail. In those ones, you have a single compound purified to target specific microorganism or a group of microorganisms. But that, nevertheless, don't forget, just because herbs works, that doesn't mean anybody could go and take herbs and start selling to people. Because there is issue of toxicity. Most of these herbs are very toxic when they are not properly evaluated, when they are not studied. So you expose the people who would take these herbs to the dangerous and deleterious effect of these herbs. So the thing is, like, before even the herbalists start selling their medication, they have to evaluate the toxicity. These herbs, are they safe for human consumption? And even if they are safe, for how long can a human take it? And what class of people could take it? Pregnant women, women breastfeeding? What about people who have some certain types of diseases like hypertension, like blood pressure, and similar diseases? Because herbs are not meant for all types of diseases. So in trying to cure it, they may end up exacerbating a particular diseases, which will put the patient at the danger of developing complications.
That was Dr. Saliu Ibrahim Ismail, a Deputy Director, Research and Publication,